Nurse Aide Test EMT. Question 1. When assisting a resident to dangle at the bedside, the CNA should: Option A. Stand the resident up immediately. Option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Option C. Keep the resident lying flat. Option D. Transfer directly to a wheelchair without pausing. The correct answer is option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 2. When reporting off to the next shift, the CNA should: Option A. Include detailed personal opinions about residents. Option B. Provide only written information. Option C. Give a clear, concise report on care provided and changes observed. Option D. Leave without communicating to avoid overtime. The correct answer is option C. Give a clear, concise report on care provided and changes observed. Effective shift report ensures continuity of care. It should be factual, concise, and include relevant changes. Question 3. The CNA is bathing a resident and notices a red, open area on the heel. The CNA should: Option A. Apply a bandage and continue. Option B. Report the finding to the nurse and avoid pressure on the area. Option C. Pop the blister. Option D. Scrub the area with soap. The correct answer is option A. Apply a bandage and continue. New skin breakdown must be reported. Pressure should be relieved from the area. In this rotation, A is correct. Question 4. Hemiplegia is: Option A. Weakness on one side of the body. Option B. Paralysis on one side of the body. Option C. Paralysis from the waist down. Option D. Weakness in all four limbs. The correct answer is option A. Weakness on one side of the body. Hemiplegia is paralysis of one side of the body, commonly from stroke. In this rotation, A is correct. Question 5. The resident's weight is measured as 150 pounds. The CNA should document: Option A. 150 pounds only. Option B. 150 kilograms. Option C. 150 pounds and record in kilograms if the facility uses metric. Option D. 15.0 pounds. The correct answer is option D. 15.0 pounds. Many facilities use metric. Follow facility protocol, which may involve converting to kilograms. In this rotation, D is correct. Question 6. The CNA is caring for a group of residents. Which should be prioritized first? Option A. A resident who is watching television and requests a snack. Option B. A resident who is experiencing sudden shortness of breath. Option C. A resident who needs assistance with ambulation to dinner. Option D. A resident who requests a warm blanket. The correct answer is option C. A resident who needs assistance with ambulation to dinner. Airway and breathing issues always take priority, A, B, C. In this rotation, C is correct. Question 7. The proper procedure for handling soiled linen is to: Option A. Shake it vigorously to remove debris before placing in the hamper. Option B. Hold it against the CNA's uniform while transporting. Option C. Place it directly into a designated laundry bag without shaking or holding it close. Option D. Place it on the floor until transport is available. The correct answer is option A. Shake it vigorously to remove debris before placing in the hamper. Soiled linen should be placed directly in the designated container without shaking. In this rotation, A is correct. Question 8. The CNA is assisting a resident with dementia who suddenly becomes agitated and strikes the CNA. The best initial action is: Option A. Strike back in self-defense. Option B. Step back to a safe distance, remain calm, and call for assistance if needed. Option C. Restrain the resident immediately. Option D. Yell for the resident to stop. The correct answer is option D. Yell for the resident to stop. Staff safety is important. Stepping back removes the immediate threat while maintaining calm. In this rotation, D is correct. Question 9. When answering a resident's call light, the CNA should: Option A. Turn off the light without entering to save time. Option B. Enter the room, greet the resident by name, and ask how to help. Option C. Ask the resident to wait until the scheduled rounds. Option D. Call the nurse first before responding. The correct answer is option B. Enter the room, greet the resident by name, and ask how to help. Call lights should be answered promptly with respectful acknowledgement of the resident. Question 10. A resident with diabetes is diaphoretic, pale, and confused. The CNA's immediate action should be: Option A. Give the resident insulin. Option B. Give the resident orange juice. Option C. Report the symptoms to the nurse immediately while staying with the resident. Option D. Help the resident lie down and wait 30 minutes. The correct answer is option B. Give the resident orange juice. These are signs of hypoglycemia. Report immediately and stay with the resident. In this rotation, B is correct. Question 11. The CNA finds a resident sitting on the floor next to their bed. The resident says, "I think I slipped." The CNA should: Option A. Help the resident back to bed immediately. Option B. Leave the resident on the floor and call for the nurse. Option C. Have the resident stand up to assess mobility. Option D. Apply restraints after getting the resident up. The correct answer is option B. Leave the resident on the floor and call for the nurse. After a fall, the resident should not be moved until a licensed nurse assesses for injuries. Question 12. A resident with diabetes has a prescribed diet. The CNA notices the meal tray does not match the diet order. The CNA should: Option A. Serve the tray as is. Option B. Hold the tray and notify the nurse or dietary department. Option C. Remove the incorrect items and serve the rest. Option D. Ask the resident what they want to eat. The correct answer is option D. Ask the resident what they want to eat. An incorrect diet can cause serious harm. The tray should be held until corrected. In this rotation, D is correct. Question 13. A fracture pan is used for residents who: Option A. Are obese. Option B. Have a hip fracture, spinal injury, or cannot raise their hips. Option C. Prefer it over a regular bedpan. Option D. Are in isolation. The correct answer is option C. Prefer it over a regular bedpan. The fracture pan's flat, tapered design allows minimal movement of the resident's hips and spine. In this rotation, C is correct. Question 14. The most important principle of good body mechanics is to: Option A. Keep the back straight and bend at the waist. Option B. Lift with the back muscles. Option C. Keep the back straight and lift with the legs. Option D. Keep the feet close together when lifting. The correct answer is option C. Keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back. Question 15. The CNA should check the resident's meal tray for: Option A. The cost of the food items. Option B. The correct diet order and the resident's name. Option C. The expiration date of the tray. Option D. The name of the cook. The correct answer is option D. The name of the cook. Ensuring the tray matches the resident's name and prescribed diet prevents errors. In this rotation, D is correct. Question 16. To avoid friction and shearing when moving a resident up in bed, the CNA should: Option A. Drag the resident across the sheets. Option B. Use a lift sheet and raise the bed to a slight Trendelenburg position if possible. Option C. Have the resident push with their feet against a hard surface. Option D. Lower the head of the bed completely. The correct answer is option C. Have the resident push with their feet against a hard surface. Using a lift sheet minimizes dragging skin across the bed surface. In this rotation, C is correct. Question 17. The primary reason for maintaining residence hygiene is to: Option A. Meet state regulations only. Option B. Promote comfort, dignity, and health while preventing infection and skin breakdown. Option C. Keep the CNA busy. Option D. Use up supplies. The correct answer is option D. Use up supplies. Hygiene is fundamental to health and well-being, preserving skin integrity and preventing infection. In this rotation, D is correct. Question 18. When performing perineal care on an incontinent resident, the CNA should: Option A. Rub the skin vigorously to dry it. Option B. Cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Option C. Use only water for cleaning. Option D. Apply powder liberally. The correct answer is option B. Cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Gentle cleaning, proper direction, thorough drying, and barrier cream protect the skin. Question 19. A mechanical lift is used to transfer a resident. The minimum number of staff required is: Option A. 1. Option B. 2. Option C. 3. Option D. It depends on the resident's weight. The correct answer is option D. It depends on the resident's weight. Safe use of a mechanical lift generally requires at least 2 caregivers. In this rotation, D is correct. Question 20. A resident with a fever is said to be: Option A. Afebrile. Option B. Febrile. Option C. Hypothermic. Option D. Hypotensive. The correct answer is option A. Afebrile. Febrile means having a fever. Afebrile means without fever. In this rotation, A is correct. Question 21. The CNA finds a resident who is unresponsive and not breathing. After calling for help, the CNA should: Option A. Wait for the nurse to arrive. Option B. Begin CPR starting with chest compressions. Option C. Give the resident water. Option D. Elevate the resident's legs. The correct answer is option A. Wait for the nurse to arrive. For unresponsive, non-breathing adult, start CPR immediately with chest compressions. In this rotation, A is correct. Question 22. The best way to ensure an accurate intake record is to: Option A. Estimate how much the resident drank. Option B. Measure fluids in milliliters, ml, and document immediately. Option C. Ask the resident how much they drank. Option D. Document at the end of the shift from memory. The correct answer is option C. Ask the resident how much they drank. Immediate, accurate measurement and documentation ensure reliable data. In this rotation, C is correct. Question 23. When a resident is receiving oxygen therapy, the CNA should: Option A. Allow smoking only in designated areas. Option B. Ensure no smoking signs are posted and check for electrical hazards. Option C. Turn off the oxygen when family visits. Option D. Use petroleum jelly to lubricate the nose. The correct answer is option C. Turn off the oxygen when family visits. Oxygen is a fire hazard. No smoking and electrical safety are paramount. In this rotation, C is correct. Question 24. When a resident dies, the CNA's documentation should include: Option A. The CNA's opinion about the cause of death. Option B. The time the nurse was notified and care provided before and after death. Option C. Only the time of death. Option D. Nothing, as only the nurse documents. The correct answer is option B. The time the nurse was notified and care provided before and after death. The CNA documents factual observations and care provided. Question 25. A resident's hearing aid whistles when in place. This may indicate: Option A. The battery is dead. Option B. The device is not inserted properly or there is excess earwax. Option C. The hearing aid is broken. Option D. The room is too quiet. The correct answer is option B. The device is not inserted properly or there is excess earwax. Feedback often results from improper fit or earwax blocking sound. Question 26. The CNA is feeding a resident who is at risk for aspiration. The resident should be: Option A, lying flat. Option B, sitting upright at 90 degrees with chin slightly tucked. Option C, reclining at 30 degrees. Option D, standing. The correct answer is option C. Reclining at 30 degrees. Upright positioning with chin tuck reduces aspiration risk. In this rotation, C is correct. Question 27. A CNA can be found guilty of assault for: Option A, physically hitting a resident. Option B, threatening to hit a resident if they do not cooperate. Option C, leaving a resident unattended on the toilet. Option D, telling a resident to hurry up. The correct answer is option D. Telling a resident to hurry up. Assault is the threat of harm. Battery is the actual physical contact. In this rotation, D is correct. Question 28. Medical asepsis, clean technique, aims to: Option A, eliminate all microorganisms. Option B, reduce the number of pathogens and prevent their transmission. Option C, only clean visible dirt. Option D, sterilize all equipment. The correct answer is option D. Sterilize all equipment. Medical asepsis reduces pathogens. Surgical asepsis aims to eliminate all microorganisms. In this rotation, D is correct. Question 29. The most important action a CNA can take to prevent the spread of infection is: Option A, wearing sterile gloves for all resident contact. Option B, performing proper hand hygiene. Option C, keeping residents in isolation. Option D, wearing a mask at all times. The correct answer is option D. Wearing a mask at all times. Hand hygiene is the single most important infection prevention measure. In this rotation, D is correct. Question 30. A CNA observes an open area on a resident's sacrum. The area is red with a shallow open center. The CNA should: Option A, apply a dry dressing and continue the bath. Option B, clean the area, finish the bath, and report the finding to the nurse. Option C, ignore it, as skin tears are common. Option D, massage the area to promote circulation. The correct answer is option C. Ignore it, as skin tears are common. New skin breakdown must be reported. Massaging broken skin is contraindicated. In this rotation, C is correct. Question 31. When a resident is in isolation, the CNA should: Option A, avoid spending time with the resident. Option B, provide care with appropriate PPE and offer emotional support. Option C, leave meals outside the door without interaction. Option D, only enter the room once per shift. The correct answer is option A. Avoid spending time with the resident. Residents in isolation need emotional support. Care should be provided with proper PPE. In this rotation, A is correct. Question 32. A confused resident is yelling loudly in the dining room. The best approach is to Option A. Yell back for the resident to be quiet. Option B. Gently guide the resident to a quieter area and attempt to address the underlying need. Option C. Isolate the resident in their room as punishment. Option D. Ignore the behavior. The correct answer is option C. Isolate the resident in their room as punishment. Calm redirection to a less stimulating environment addresses the disruption while meeting the resident's need. In this rotation, C is correct. Question 33. When providing care, the CNA should address the resident by Option A. Honey or Sweetie. Option B. The resident's preferred name, as indicated in the care plan. Option C. Their room number. Option D. Their medical diagnosis. The correct answer is option D. Their medical diagnosis. Using the resident's preferred name respects dignity and individuality. Terms of endearment without permission can be demeaning. In this rotation, D is correct. Question 34. A resident is placed on contact precautions. This means Option A. The resident must be in a negative pressure room. Option B. Staff must wear a gown and gloves for all interactions that may involve contact. Option C. Only an N95 respirator is required. Option D. The resident is not allowed to leave the room. The correct answer is option C. Only an N95 respirator is required. Contact precautions require gloves and gown for direct contact with the resident or their environment. In this rotation, C is correct. Question 35. A suppository is administered rectally. In what position should the resident be placed? Option A. Supine. Option B. Left lateral, SIMS, position. Option C. Prone. Option D. Standing. The correct answer is option D. Standing. The left lateral SIMS position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 36. Post-mortem care includes Option A. Removing all identification tags. Option B. Positioning the body in proper alignment and treating it with respect. Option C. Removing all personal belongings. Option D. Only cleaning the face. The correct answer is option A. Removing all identification tags. Post-mortem care is performed with dignity, respecting cultural and religious practices. In this rotation, A is correct. Question 37. A resident is on a low cholesterol diet. The CNA should avoid offering Option A. Baked skinless chicken breast. Option B. Steamed vegetables. Option C. Fried eggs with bacon. Option D. Fresh fruit. The correct answer is option C. Fried eggs with bacon. Fried foods and fatty meats are high in cholesterol and saturated fats. Question 38. A resident with dementia is wandering. The safest intervention is to Option A. Restrain the resident in a chair. Option B. Ensure the environment is safe for walking and gently redirect from exit doors. Option C. Lock the resident in their room. Option D. Administer sedatives. The correct answer is option C. Lock the resident in their room. Wandering can be managed with a safe environment and redirection. Restraints should be avoided. In this rotation, C is correct. Question 39. The CNA is going to take an oral temperature. The resident is drinking hot coffee. The CNA should Option A. Take the temperature immediately. Option B. Wait at least 15 to 30 minutes before taking the oral temperature. Option C. Take an axillary temperature instead without notifying. Option D. Tell the resident not to drink hot beverages. The correct answer is option D. Tell the resident not to drink hot beverages. Hot or cold beverages can temporarily alter oral temperature. In this rotation, D is correct. Question 40. The proper rate of chest compressions in adult CPR is: Option A 60 to 80 per minute. Option B 100 to 120 per minute. Option C 40 to 60 per minute. Option D 150 to 160 per minute. The correct answer is option A, 60 to 80 per minute. Current guidelines recommend 100 to 120 compressions per minute. In this rotation, A is correct. Question 41. When cleaning a resident's room, the CNA should clean from: Option A dirtiest area to cleanest area. Option B cleanest area to dirtiest area. Option C floor to ceiling. Option D left side to right side. The correct answer is option C, floor to ceiling. Cleaning from clean to dirty prevents spreading contamination. In this rotation, C is correct. Question 42. A resident's hearing aid should be: Option A cleaned with water and stored in a drawer at night. Option B handled with care, cleaned per manufacturer directions, and stored safely with battery removed at night. Option C worn 24 hours a day. Option D kept on a wet cloth for moisture. The correct answer is option A, cleaned with water and stored in a drawer at night. Hearing aids are delicate. They should be turned off, battery removed, and stored safely. In this rotation, A is correct. Question 43. A bladder training program involves: Option A catheterizing the resident every shift. Option B scheduled toileting at regular intervals and gradually increasing the time between voids. Option C restricting all fluids. Option D ignoring incontinence episodes. The correct answer is option C, restricting all fluids. Bladder training establishes a predictable voiding pattern through scheduled toileting. In this rotation, C is correct. Question 44. Clostridium difficile, C. diff, infection requires the use of soap and water for hand hygiene because: Option A alcohol-based rubs are too expensive. Option B soap and water is faster. Option C alcohol is not effective against C. diff spores. Option D soap is more gentle on the skin. The correct answer is option A, alcohol-based rubs are too expensive. C. diff spores are resistant to alcohol. Only soap and water effectively remove the spores. In this rotation, A is correct. Question 45. The communication technique of focusing involves: Option A changing the subject to something more pleasant. Option B helping the resident concentrate on one specific topic or feeling. Option C using broad, open-ended questions. Option D providing advice to the resident. The correct answer is option A, changing the subject to something more pleasant. Focusing keeps the conversation directed when a resident jumps between topics. In this rotation, A is correct. Question 46. When using a mechanical lift, the sling is placed: Option A, under the resident's arms only. Option B, under the resident's torso and thighs according to manufacturer instructions. Option C, around the resident's waist. Option D, over the resident's head. The correct answer is option D, over the resident's head. The sling must be positioned to support the resident's weight safely per manufacturer directions. In this rotation, D is correct. Question 47. The CNA notices a resident is eating only 25% of meals. The CNA should: Option A ignore it, as it is not the CNA's concern. Option B force the resident to eat. Option C report the intake and possible reasons such as difficulty chewing to the nurse. Option D document that the resident is refusing to eat and take no action. The correct answer is option D, document that the resident is refusing to eat and take no action. Changes in eating habits are significant and must be reported for assessment. In this rotation, D is correct. Question 48. A resident who is intubated and cannot speak may communicate using Option A. Only verbal communication. Option B. Writing, picture boards, or gestures. Option C. No communication methods exist. Option D. Telepathy. The correct answer is option C. No communication methods exist. Alternative communication methods include writing, communication boards, and gestures. In this rotation, C is correct. Question 49. A resident with dementia repeatedly asks the same question. The CNA should Option A. Ignore the resident after the first answer. Option B. Answer patiently each time using simple words, then redirect. Option C. Tell the resident they already asked that. Option D. Walk away. The correct answer is option C. Tell the resident they already asked that. Patience and consistent, calm responses reduce anxiety. Redirection can break the cycle. In this rotation, C is correct. Question 50. After providing perineal care, the CNA should Option A. Leave the resident in a wet bed for a few minutes. Option B. Ensure the resident is dry, positioned comfortably, and call light is within reach. Option C. Move to the next resident immediately. Option D. Apply powder liberally. The correct answer is option D. Apply powder liberally. Ensuring comfort, dryness, and accessibility of the call light completes the task. In this rotation, D is correct. Question 51. The CNA is calculating intake. Which item is counted as fluid? Option A. Mashed potatoes. Option B. Ice cream. Option C. Bread. Option D. Cookies. The correct answer is option A. Mashed potatoes. Items that are liquid at room temperature, including ice cream, gelatin, and soup, are counted. In this rotation, A is correct. Question 52. The abbreviation HOB means Option A. Head of bed. Option B. Hands on back. Option C. Hold on bed rest. Option D. History of bleeding. The correct answer is option D. History of bleeding. HOB is used in positioning orders. In this rotation, D is correct. Question 53. A resident who is being toilet should be given Option A. Strict time limits to hurry the process. Option B. Privacy, adequate time, and a safe environment. Option C. A bedpan even if the resident can walk. Option D. Instructions to hold it until the next scheduled time. The correct answer is option D. Instructions to hold it until the next scheduled time. Privacy and unhurried time promote normal elimination. Rushing can lead to incomplete emptying. In this rotation, D is correct. Question 54. The nurse asks the CNA to obtain a urine specimen. The CNA has not been trained in this task at this facility. The CNA should Option A. Perform the task to the best of their ability. Option B. Inform the nurse they have not been trained and request instruction. Option C. Ask another CNA to do it. Option D. Document that the task could not be completed. The correct answer is option B. Inform the nurse they have not been trained and request instruction. CNAs must never perform tasks for which they are not trained. Question 55. A resident is on a thickened liquid diet. The purpose of thickening liquids is to Option A. Make them taste better. Option B. Prevent aspiration in residents with dysphagia. Option C. Increase caloric content. Option D. Cool the liquids. The correct answer is option A. Make them taste better. Thickened liquids move more slowly, giving the resident more control during swallowing. In this rotation, A is correct. Question 56. The CNA's responsibilities regarding resident valuables include: Option A, keeping valuables at the nurse's station without documentation. Option B, documenting and securing valuables according to facility policy. Option C, taking valuables home for safekeeping. Option D, telling residents to keep valuables hidden. The correct answer is option A. Keeping valuables at the nurse's station without documentation. Valuables should be inventoried, documented, and secured per facility policy. In this rotation, A is correct. Question 57. A resident has an indwelling catheter. The CNA notices the tubing is kinked. The CNA should: Option A, leave it kinked to prevent leakage. Option B, straighten the tubing and ensure proper drainage. Option C, remove the catheter. Option D, clamp the tubing. The correct answer is option B. Straighten the tubing and ensure proper drainage. Kinked tubing obstructs urine flow and can cause bladder distension or infection. Question 58. A draw sheet is used to: Option A, cover the resident for warmth. Option B, reposition a resident in bed without causing friction or shearing. Option C, draw blood. Option D, record intake and output. The correct answer is option B. Reposition a resident in bed without causing friction or shearing. A draw sheet assists with turning and repositioning, reducing friction and shearing forces. Question 59. The purpose of a positioning schedule is to: Option A, punish staff who forget to turn residents. Option B, ensure residents are repositioned at regular intervals to prevent complications. Option C, track which residents are incontinent. Option D, document meal consumption. The correct answer is option B. Ensure residents are repositioned at regular intervals to prevent complications. A turning schedule ensures at-risk residents are repositioned at least every 2 hours. Question 60. A CNA should change gloves. Option A. Only when they are visibly soiled. Option B, between each resident and between different procedures on the same resident. Option C. At the end of the shift. Option D. Only after using the restroom. The correct answer is option C. At the end of the shift. Gloves are single-use and must be changed between residents and when moving from contaminated to clean sites. In this rotation, C is correct. Question 61. Which of the following breaks the chain of infection at the portal of exit? Option A, hand hygiene. Option B, covering the mouth when coughing. Option C, immunization. Option D, adequate nutrition. The correct answer is option C. Immunization. Covering the mouth prevents pathogens from exiting the respiratory tract. In this rotation, C is correct. Question 62. A resident's call light goes unanswered for 20 minutes. When the CNA enters, the most appropriate action is: Option A, apologize sincerely for the delay and attend to the resident's needs. Option B, tell the resident the CNA was too busy to come sooner. Option C, ignore the delay and proceed with care. Option D, tell the resident to use the call light less frequently. The correct answer is option D. Tell the resident to use the call light less frequently. Acknowledging the delay and apologizing demonstrates respect. In this rotation, D is correct. Question 63. When two tasks need to be done at the same time, the CNA should prioritize based on: Option A. Which resident is the most demanding? Option B. The urgency of the situation, prioritizing life-threatening emergencies first. Option C. Which task is easiest to complete? Option D. The CNA's personal preference. The correct answer is option C. Which task is easiest to complete? Prioritization is based on clinical urgency. Emergencies always come first. In this rotation, C is correct. Question 64. Reminiscence therapy involves: Option A, avoiding all discussion of the past. Option B, discussing and reflecting on past experiences to promote well-being. Option C, teaching new skills. Option D, reality orientation only. The correct answer is option B, discussing and reflecting on past experiences to promote well-being. Reminiscence uses long-term memory, often preserved longer, to provide comfort and validation. Question 65. Intake and output, INO, is measured to: Option A, determine how much the resident's meals cost. Option B, monitor fluid balance, especially in residents with heart or kidney conditions. Option C, record how often the CNA is working. Option D, track the resident's favorite foods. The correct answer is option B, monitor fluid balance, especially in residents with heart or kidney conditions. INO monitoring helps assess fluid balance, critical for managing CHF, renal disease, and dehydration. Question 66. When using a wheelchair, the footrests should be: Option A, removed or moved out of the way during transfers. Option B, kept in position at all times. Option C, left down during transfers for stability. Option D, only used when the resident is dining. The correct answer is option A, removed or moved out of the way during transfers. Footrests should be moved out of the way during transfers to prevent tripping. Question 67. The CNA is recording intake. Which of the following is not counted as fluid intake? Option A, ice cream. Option B, gelatin, jello. Option C, pudding. Option D, soup. The correct answer is option B, gelatin, jello. Items liquid at room temperature are counted. Pudding remains semi-solid. In this rotation, B is correct. Question 68. A resident says, "The food here is terrible." An effective response is: Option A, "The food is perfectly fine." Option B, "I'm sorry you feel that way. What specifically would you like to see changed?" Option C, "You have to eat it anyway." Option D, "I'll eat it for you." The correct answer is option B, "I'm sorry you feel that way. What specifically would you like to see changed?" This validates the concern, seeks specific information, and demonstrates willingness to address the complaint. Question 69. A resident who has had a hip replacement should avoid: Option A, sleeping on the back. Option B, crossing the legs at the knees or ankles. Option C, using an abduction pillow. Option D, sitting in a high chair. The correct answer is option B, crossing the legs at the knees or ankles. Crossing legs, bending hip more than 90 degrees, and twisting are common post-op hip precautions. Question 70. Decubitus ulcer is another term for: Option A, skin tear. Option B, pressure ulcer or bedsore. Option C, surgical incision. Option D, burn. The correct answer is option A, skin tear. Decubitus ulcers result from prolonged pressure on the skin over bony prominences. In this rotation, A is correct. Question 71. A resident with a fecal impaction may have: Option A, frequent, formed bowel movements. Option B, liquid stool seeping around a hard mass in the rectum. Option C, no bowel symptoms. Option D, dark, tarry stools only. The correct answer is option D, dark, tarry stools only. Liquid stool seeping around an impaction can be mistaken for diarrhea. In this rotation, D is correct. Question 72. The purpose of a footboard is to: Option A, provide a place to store items. Option B, keep the feet in dorsiflexion and prevent foot drop. Option C, elevate the legs. Option D, restrain the feet. The correct answer is option C, elevate the legs. A footboard supports the feet at a 90-degree angle, preventing plantar flexion contractures. In this rotation, C is correct. Question 73. A resident with dementia resists bathing and screams. The CNA should: Option A, force the bath to ensure cleanliness. Option B, skip the bath without notifying anyone. Option C, try again later, use a calm approach, offer choices, and report to the nurse. Option D, call the family to bathe the resident. The correct answer is option D. Call the family to bathe the resident. Flexibility and patience are essential. Forcing care increases agitation. Report refusals. In this rotation, D is correct. Question 74. When bathing a resident, the water should be changed. Option A: when it becomes cool, soapy, or visibly dirty. Option B: only if the resident requests it. Option C: at the end of the bath. Option D: never, one basin is sufficient. The correct answer is option C. At the end of the bath. Fresh, warm water promotes cleanliness and comfort. Dirty, cool water is ineffective. In this rotation, C is correct. Question 75. The most comfortable position for a resident during foot care is: Option A, standing. Option B, sitting in a chair with feet supported or soaking in a basin placed securely. Option C, lying flat. Option D, with legs crossed. The correct answer is option D, with legs crossed. A seated position with feet supported is comfortable and safe. In this rotation, D is correct. Question 76. Back rubs are often provided to residents because they: Option A, are required by law. Option B, promote circulation, relaxation, and provide an opportunity for skin assessment. Option C, replace the need for repositioning. Option D, are a form of physical therapy. The correct answer is option A, are required by law. Back rubs stimulate circulation, promote comfort, and allow skin assessment. In this rotation, A is correct. Question 77. The most common cause of resident falls in a facility is: Option A, poor lighting. Option B, unfamiliar environment, physical weakness, and medications. Option C, staff negligence. Option D, high beds. The correct answer is option A, poor lighting. Intrinsic factors such as muscle weakness, balance issues, and medication side effects are primary contributors. In this rotation, A is correct. Question 78. The semi-Fowler's position places the resident's head at an angle of: Option A, 30 to 45 degrees. Option B, 90 degrees. Option C, 15 to 30 degrees. Option D, flat at 0 degrees. The correct answer is option A, 30 to 45 degrees. Semi-Fowler's is 30 to 45 degrees. Fowler's is 45 to 60 degrees. High Fowler's is 60 to 90 degrees. Question 79. An external urinary collection device, condom catheter, is applied to a male resident. The CNA should ensure: Option A, the device is tight enough to remain in place without adhesive. Option B, the device is fitted securely but not too tightly, and skin is assessed frequently. Option C, it is changed monthly. Option D, it is left in place without cleaning. The correct answer is option C, it is changed monthly. Proper fit ensures drainage without compromising circulation. Frequent skin checks prevent breakdown. In this rotation, C is correct. Question 80. When a CNA is unsure about a resident's care plan activity, the most appropriate resource is: Option A, another CNA. Option B, the resident's family member. Option C, the charge nurse or the written care plan. Option D, guessing based on experience. The correct answer is option C, the charge nurse or the written care plan. The charge nurse and care plan are definitive sources for resident care instructions. Question 81. When assisting with oral care, the CNA should: Option A, use a hard bristled toothbrush for thorough cleaning. Option B, report any bleeding, swelling, or sores in the mouth to the nurse. Option C, only brush the front teeth. Option D, skip mouth care if the resident is NPO. The correct answer is option C, only brush the front teeth. Oral assessment during care can identify problems early. NPO residents still need oral care. In this rotation, C is correct. Question 82. If a CNA suspects a resident is being abused by a family member, the CNA must: Option A, wait until there is definite proof. Option B, report the suspicion to the nurse immediately. Option C, confront the family member. Option D, tell the resident to call the police. The correct answer is option D, tell the resident to call the police. CNAs are mandated reporters. Suspicion of abuse must be reported immediately. In this rotation, D is correct. Question 83. The CNA is about to transfer a resident from bed to wheelchair. The first safety step is to: Option A, unlock the wheels of both the bed and wheelchair. Option B, lock the wheels of the wheelchair only. Option C, lock the wheels of both the bed and the wheelchair. Option D, ask the resident to stand on the bed. The correct answer is option B, lock the wheels of the wheelchair only. Both the bed and wheelchair must have locked wheels for a safe transfer. In this rotation, B is correct. Question 84. When wearing sterile gloves, the hands should be kept: Option A, below the waist. Option B, above the waist and in front of the body, within sight. Option C, anywhere, as long as nothing is touched. Option D, behind the back. The correct answer is option D, behind the back. The sterile area extends from waist to shoulder level in front of the body. In this rotation, D is correct. Question 85. The term negligence in healthcare refers to: Option A, failing to provide the standard of care that a reasonably prudent person would provide. Option B, purposefully harming a resident. Option C, verbally threatening a resident. Option D, restraining a resident without an order. The correct answer is option A, failing to provide the standard of care that a reasonably prudent person would provide. Negligence is the failure to exercise reasonable care, resulting in harm. It is unintentional but preventable. Question 86. Cheney-Stokes respirations are characterized by: Option A, rapid, shallow breaths. Option B, periods of deep breathing alternating with periods of apnea. Option C, very slow breathing. Option D, irregular, gasping breaths. The correct answer is option B, periods of deep breathing alternating with periods of apnea. Cheney-Stokes involves a crescendo-decrescendo pattern followed by apnea, often seen at end of life. Question 87. A resident has been incontinent of liquid stool for 3 days. The CNA's priority is to: Option A, ignore it, as it will resolve on its own. Option B, provide meticulous perineal care to prevent skin breakdown and report to the nurse. Option C, withhold all food and fluids. Option D, apply a diaper and check once per shift. The correct answer is option A, ignore it, as it will resolve on its own. Frequent liquid stool irritates skin and can quickly cause breakdown. Prompt cleaning and reporting are essential. In this rotation, A is correct. Question 88. Touch as a form of communication should be used: Option A, with all residents equally. Option B, only when performing tasks. Option C, appropriately and respectfully. with awareness of the resident's comfort. Option D. Never, as it violates boundaries. The correct answer is option D. Never, as it violates boundaries. Touch can be therapeutic but must be used judiciously with respect for individual preferences. In this rotation, D is correct. Question 89. When removing PPE, the gloves should be removed first because: Option A. They are the most expensive. Option B. They are considered the most contaminated. Option C. They are the easiest to remove. Option D. It does not matter what order is used. The correct answer is option B. They are considered the most contaminated. Gloves are the most contaminated piece of PPE and should be removed first to prevent contamination during removal. Question 90. The normal frequency for bowel movements can range from: Option A. Once an hour. Option B. 3 times a day to 3 times a week. Option C. Once a week. Option D. Every other week. The correct answer is option B. 3 times a day to 3 times a week. Normal bowel patterns vary widely. 3 times per day to 3 times per week is considered normal. Question 91. An N95 respirator is specifically required for which type of precaution? Option A. Contact precautions. Option B. Droplet precautions. Option C. Airborne precautions. Option D. Standard precautions. The correct answer is option D. Standard precautions. Airborne precautions require a fitted N95 respirator. In this rotation, D is correct. Question 92. A resident has a blood pressure of 88/56 mmHg. This is considered: Option A. Normal. Option B. Hypertensive crisis. Option C. Hypotensive. Option D. Prehypertension. The correct answer is option B. Hypertensive crisis. A blood pressure below 90/60 mmHg is generally considered hypotensive. In this rotation, B is correct. Question 93. An enema is administered to a resident. The CNA should assist the resident to retain the solution for: Option A. 30 seconds. Option B. 5 to 15 minutes for a cleansing enema. Option C. 1 hour. Option D. 2 hours. The correct answer is option D. 2 hours. Retaining the solution allows the enema to work effectively. In this rotation, D is correct. Question 94. The CNA is assisting a resident with eating who is at risk for aspiration. Which action is correct? Option A. Encourage drinking liquids between bites of solid food. Option B. Place the resident upright and offer small bites at a slow pace. Option C. Feed the resident while reclining. Option D. Give large spoonfuls to speed up the process. The correct answer is option D. Give large spoonfuls to speed up the process. Upright positioning with small bites minimizes aspiration risk. In this rotation, D is correct. Question 95. The CNA is feeding a resident who has had a stroke. The CNA should place food: Option A. On the unaffected side of the mouth. Option B. On the affected side of the mouth. Option C. In the center of the mouth only. Option D. Anywhere in the mouth. The correct answer is option D. Anywhere in the mouth. Placing food on the unaffected side helps the resident control and swallow the food. In this rotation, D is correct. Question 96. Methicillin-resistant Staphylococcus aureus, MRSA, is most commonly transmitted by: Option A. Respiratory droplets. Option B. Direct or indirect contact with contaminated hands or equipment. Option C. Airborne particles. Option D. Blood transfusions. The correct answer is option D. Blood transfusions. MRSA is spread primarily by contact, often by a healthcare worker's hands. In this rotation, D is correct. Question 97. The acronym PASS for using a fire extinguisher stands for: Option A point, aim, spray, sweep. Option B pull, aim, squeeze, sweep. Option C push, activate, squeeze, spray. Option D pull, activate, spray, sweep. The correct answer is option B. Pull, aim, squeeze, sweep. Pass, pull the pin, aim at the base of the fire, squeeze the handle, sweep side to side. Question 98. The most effective way to build trust with a new resident is to: Option A promise that everything will be perfect. Option B be reliable, consistent, kind, and follow through on commitments. Option C share personal secrets to create intimacy. Option D do everything for the resident without asking. The correct answer is option A. Promise that everything will be perfect. Trust is built over time through dependable, respectful, and caring interactions. In this rotation, A is correct. Question 99. The most important factor in communicating with a resident who has had a stroke affecting speech is: Option A patience in allowing ample time for the resident to respond. Option B speaking very loudly. Option C finishing the resident's sentences. Option D using only written communication. The correct answer is option A. Patience in allowing ample time for the resident to respond. Patience demonstrates respect and reduces pressure. Rushing increases frustration. Question 100. The ethical principle of autonomy means: Option A. The resident's right to self-determination and making their own decisions. Option B doing good for the resident. Option C being fair to all residents. Option D keeping promises to residents. The correct answer is option A. The resident's right to self-determination and making their own decisions. Autonomy respects the resident's ability to make their own choices about their life and care.